Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And to that point, the show that we have today is entitled Be an Empowered Consumer. And our topic about empowerment today covers, is your provider, meaning your healthcare person, your doctor, your nurse, whoever you are dealing with in the healthcare system, are they culturally competent? Now you may be saying, what's culturally competent really mean? Well, we're going to address that. We're going to have the definition. We're going to talk about how you as a consumer need to be aware of your own cultural changes and competencies that you need to have as a consumer when you talk to your provider. So today we are going to talk about 3 key points in this cultural competence world. We're going to ask you to be really your own assessor of your provider's cultural competence. How do they work with you? Do they know your background? Do they know your culture? Do they know who you are? Because it's really important in terms of how your treatment plan is going to be constructed. The second is, you as a culturally sensitive person to your own culture do not necessarily have to look for someone to treat you who comes from the exact same background. We're going to talk about how cultural competence is now becoming a norm. All providers need to have cultural competence so that they can take care of you no matter what their background may be. The third area that we're going to talk about is that you need to be forthcoming with your healthcare provider. You don't want to hide who you are or your preferences or the cultural things that make you unique. You need to have the empowerment to be very upfront and share with your providers who you are. So who's going to help us with this very challenging topic? Well, we have a wonderful and extremely knowledgeable guest with us today, Dr. Rita Adeniran. And Rita is an amazing person. She comes from Africa. She has really had an incredible transition here to the United States. She has a lovely husband and 5 children. So in addition to that, she is very well educated and has been at the University of Pennsylvania for more than 14 years in a very key role with this cultural competence area. Her title was Director for Diversity and Inclusion, and she really helped the University of Pennsylvania health system, their doctors, their nurses, their entire staff, really understand and be able to use these skills. She is currently on faculty also at the University of Pennsylvania School of Nursing. But her main role right now is President and CEO of Innovative and Inclusive Global Solutions. So she is now consulting and taking her skills and knowledge all around the country and helping other provider teams to really be able to have these skills. So with that introduction, I want to welcome you, Rita, to our table. You've been back. You've done some other programs with us, and we're just delighted to have you come back with us. And I have to just say, very few guests come looking as glamorous as you do in your culturally sensitive garb. So welcome.
Thank you, Nancy. Thanks for that humbling introduction. So yes, today we'll be talking about cultural competency. So I'd just like to provide some background about cultural competency.
Right, because I think that that's a term that people may have heard, but I don't think many of our guests would really be able to say, and the definition is, so you're going to tell us what that is.
Okay, I'll get to the definition, but first, cultural competency has the potential to mitigate healthcare disparities, meaning unequal treatment across populations, reduce the cost of health care, and improve outcomes for every patient. Cultural competency increased access and engage patients and their families in their own plan of care for optimal outcomes.
Right. But when you think of cultural competency, let's sort of back up. Is everybody involved as far as their culture? Or are we only talking about certain cultures?
Everybody is involved. Everybody has a culture. And in addition to, when we talk about culture, we have to look at it in its broader sense. So what
Okay.
is culture? In reality and in its simplest form, culture is the way of the life of a people. So as a community, there's a culture. As an individual, there's a culture. Even as healthcare profession is a culture. Healthcare organization has a culture. And within the context of healthcare delivery, all these cultures collate together. And what is important here is, how do clinicians understand the culture, the uniqueness of every patient within the context of their illness to provide care that is congruent, meaning care that meets the need of that patient within the patient culture. And I can give you examples about that.
Okay, but I think what I'm hearing Rita say is that there is absolutely no one size fits all in terms of the treatment plan. So in terms of who you are and what is meaningful to you, and how you are even hearing what a healthcare provider is recommending to you, may be highly influenced by your background, by who you are, your culture.
Yeah.
So the first key point is that every healthcare provider really has to be sensitive to the many cultures that are going to walk through that person's door, or in a hospital, all those different people in different beds. They're all going to have their unique cultural background.
So if I could define for you what is cultural competence.
Okay.
So cultural competence is the ability of a clinician to be able to provide care that is congruent with the patient cultural health values. So whatever that value of that patient is, whatever their belief system is, the clinician should have the skills, the knowledge, and the attitude to be able to meet the need of that patient within the clinical context or in an encounter.
Okay, so that sounds like a tall order, because not only do physicians and nurses and everyone else that's on the healthcare team have to have skill in diagnosing and treating and drug therapy and physical therapy, but they have to have this, I suppose, communication skill and understanding to know why that patient would respond in a certain way. Is that a good summary?
It's a good summary, but when you say communication, it has to be respectful communication that maintains therapeutic relationships.
Mm-hmm. So how would a clinician figure this out? How do they go in and meet someone and get to know their culture?
Okay, when you talk about cultural competence, the first and the most essential ingredient is the personal desire of a clinician to be able to understand their patient. So, for example, if a clinician walk into a room of an elderly patient that comes from a traditional culture where age invokes respect.
Yes.
Okay. So if that clinician, regardless of their degree, their educational background, there's a certain expectation from that patient by that patient of how the clinician should address the patient. If the clinician do not meet that expectation, there is a disconnect between the patient and the clinician, because the patient might feel insulted. So all clinicians, when you walk into a patient room, one of the starting point is understanding how that patient will want to be addressed. And that can start what they call the respectful communication.
Very good. So would a clinician go in and say to a patient, how would you like to be addressed? Would that be a good place to start?
That's a very good place to start. So if I walk into your room and Dr. Valentino, I may ask as a culturally competent nurse, my name is Rita, and Ms. Valentino, how would you like me to address you?
Okay.
So you can say to me, call me Nancy, but if you're speaking to someone like my mother, she will say, call me Mrs. Adeniran.
Yes, okay, so that's a good place to start.
Yes.
And something as simple as that really is very key, because that early connection is really going to influence the perception of the rest of the care.
Exactly, because for patients that are looking for that, if the clinicians, they're able to come in and start the conversation along those lines, the patient is put in what you call in a comfort position, understanding that this clinician is ready to understand me for who I am.
Right.
So that patient will be easily forthcoming in sharing information with the patient,
Okay.
with the clinician.
Okay, but I guess the other way of looking at this is that, say you're in a situation where the clinician, this is again a nurse, a doctor, anyone on the healthcare team that's coming in to work with you in some capacity, instead of waiting for them to ask you, how would you like to be addressed? I guess the really empowered consumer could say, doctor or nurse, I would like to be addressed as. Do you think most patients would consider doing that?
Absolutely. As a patient, you have the right, and clinicians will welcome that because you will be giving them information that they would want to know anyway.
Right.
Okay, but more importantly is that there are other nuances that might be mixed. For example, if you're from a culture that don't eat pork,
Okay.
and you're in a hospital, in an environment where you know you will be getting meals, you may want to let your clinician know that I don't eat pork, so please, can you please include that in my information? And clinicians, culturally competent clinicians, not only take that information for themselves, but they share it with members of the interprofessional team.
Right.
And it gets to the dietary department and is in your information, your chart or profile, that you do not eat pork. So there you don't get pork on your meals. So as a consumer, coming into the hospital does not necessarily mean you have to eat those things you don't eat.
Right.
It's okay to advise your providers what you don't eat or whatever the situation may be.
Right. Well, often when you're an inpatient, when you're actually staying in a hospital,
Yeah.
when you first get there, they do a lot of questioning, a lot of assessments. And usually dietary, in this case, is one of those assessments. And sometimes it can get very wearying and wearing to be asked so many questions. But this is a good example of where it's really important to have that dietary assessment so that you are going to be matched with the right foods while you're there.
Exactly.
Okay.
Exactly. So other aspect when you talk about cultural competence is really involved. There are certain cultures, religion, for example, that would have to be clean when they pray. For example, the Islamic religion. Mm-hmm. So if they may have medications such as continual infusion where they have to have IV. However, when they are praying, within the Islamic religion, some Muslims will not want to have those IV. As a culturally competent clinician, if you have those kind of patients, you may want to educate your patient that if there's a need for me to discontinue this IV while you have your prayers, I'm happy to do that. So that put the patient again in a comfortable zone to be able to know that being in the hospital, being an inpatient does not interfere with my religion. And on the other side, you as a patient, you should be empowered to let your provider know that at a certain time I will need to pray, and I would appreciate if you could come in and please disconnect this so I can pray. Mm-hmm. So those things there's always negotiation and opportunities, but it becomes a challenge if the providers don't know or if they don't ask. But as an empowered consumer, this is information that you want to put forth to your provider so that your religious beliefs are honored while you are an inpatient.
Right. And some of that is rather complicated. Let's just stick with that example for a moment.
Okay.
When you say that someone of the Islamic background, if they're having an intravenous infusion and they need to have that discontinued, do you mean that that's just shut off, or do they actually have to have the IV pulled out? I mean, and they also pray several times a day. So how does that actually work?
When I was at Penn, because one of the things that we did when I was at Penn, and I'm sure they're still doing it, is that we do everything we can to honor our patients.
Right.
So what it is, if we have patients that have those beliefs, and is that those IV gets disconnected temporarily, meaning they take out the needle because there's always an air plug, however that is, and they'll cover it and dress it neatly. And some patients completely would want it out. So however it is, we work with the patient, but we have to understand that if the healthcare environment is not welcoming and ready to affirm the power of the sick to heal themselves, then why does the already burden come? So what does this mean? If we have to really help our patients get healed, we have to respect those religious beliefs, because it's more important than any other interventions we might be given. So we work around those things and with the individual patient. So if we have to take it out, we'll take it out.
Okay. I think that's really a pretty powerful point. So going back to one of your first discussion points, Rita, is that clinicians have to have the curiosity and as well as the desire to really learn a lot of new material, because there is so much diversity in our culture now that clinicians could be meeting people from many, many different backgrounds. How are they going to learn all this?
Okay, absolutely. Like I said earlier on, yes, there is no cookbook approach to cultural competency. Like I said earlier, it's the personal desire of the clinician. So the first thing is to have that desire. Then the other thing is the knowledge. So what have you learned? And again, not only what have you learned, is what can you unlearn and relearn? Because as you know, as human beings, we work every day with stereotypes because of how our environment has fed us information. So to be a culturally competent clinician, you have to be very aware and do self-reflection about your values, and to understand that your values necessarily is not going to be the same as your patient. And that ability to self-reflect is called cultural humility. So that cultural humility of clinicians is a step towards understanding your patient and respecting their values even when it conflicts with yours.
Right.
So and that gives the clinician the ability to unlearn some of those stereotypes that you may have unconsciously learned in your way as a human being, because we as human beings, we use cognitive shortcuts that leads to stereotype. So after unlearning that, the other thing is your attitude. As a clinician, what is your attitude to difference?
Right.
For example, if a patient walked into your clinic and you're giving a prescription or a care, and they said to you, I don't have the copay for that. What is your attitude? Does that mean they're lazy, they can't pay that? So as a culturally competent clinician, you may want to look at alternatives or to medications that may fit into their insurance plan to meet their needs. You don't have the attitude as, oh, if you don't have the money, so be it.
Right.
So that is culturally competent, taking into consideration, because every patient may not have the resources for certain type of medications, and there may be other medications that will be equally potent that you may be able to prescribe or give to that patient. So that is the attitude part of it. Then the third is your actions. What actions are you willing to take as a clinician caring for culturally diverse patient population? For example, a lesbian woman walked into your clinic. Okay, are you going to ask this patient that, are you married? Or it will be your action will be, tell me a little bit about your sexual orientation. Or a transgender patient, do you use gender neutral language? So those are the actions that will make and put people in the comfort zone, not using the stereotypes or the assumptions that everybody is the same.
Right, right. I think that this is very, very interesting. It sounds very simple. When you hear it, it sounds, well, of course, that's the way to go. But having worked in many different organizations over my career, I can just picture how difficult this can be for people. Because the way the healthcare system operates in general is that it's the healthcare system that's in control and has the power. And you, no matter what your background may be, you're supposed to pretty much comply with that. That is really pretty much the message. Would you agree?
That used to be the message, and because healthcare organizations are becoming aware of the importance of cultural competency to health outcomes, because they're finding out that if it is their way or no way, patients don't get better, and it's going to be only costly to care for the patient. So now they're beginning to understand, but as you know, like anything else, change take a long time. So healthcare organizations are becoming more open
Right.
to patients' values, beliefs, and unique preferences so that they can meet that goal. So it's changing, but there's still some challenges. But one good thing that comes out of this is that I recently received a grant from the Robert Wood Johnson Foundation.
Okay, tell us about that.
Yes, to do a statewide survey in Pennsylvania about registered nurses, knowledge, attitudes, and behavior. So we wanted to understand what nurses think about cultural competence.
That's a great place to start.
Yes, it's a wonderful place. And I cannot talk about this without acknowledging my colleagues, the Nursing Diversity Council of the Pennsylvania Action Coalition, who would really work with me
Right.
and Dondra, the co-chair, to conduct this survey for the state of Pennsylvania. And I'll tell you that it is really encouraging because over the preliminary analysis is showing that over 99% of nurses states that they're interested and would like to provide culturally competent care for their patients.
Right. I think that that's really a good sign. I mean, I think from Rita's survey of nurses in Pennsylvania, and it would be interesting to do this survey in other states and see how much comprehensive knowledge we could get about nurses in general. But just sticking with Pennsylvania as the first cut of this, it is encouraging to know that people may not know how to do it, but they want to do it.
Exactly. Exactly.
That's the first hurdle to get over. People want to do the right thing, and they want to then get the knowledge and the skills, I would assume, to be able to do it, right? Is that what you're taking away from this?
Nancy, you just hit the nail on the head. Cultural competency is the want to, not the have to.
Right.
So nurses in Pennsylvania, from our findings, saying to us, they want to provide culturally competent care. And part of the survey, we asked, what are the barriers to them providing culturally competent care? And some of the things that we learned, the factors, is that sometimes they do not have the resources. Healthcare organization, that was what led me to this, is that healthcare organizations sometimes do not have all the resources necessary to support clinicians like nurses to provide culturally competent care. There have been some improvement in that. For example, as the demographics of our country change, we are having a lot of different languages.
Right.
So when a patient that comes from a rare language that an organization do not often receive, sometimes there's a barrier in communication, and nurses know the importance of effective communication with their patients. And sometimes if there's no infrastructure for them to get an interpreter phone or an interpreter line or even a video interpretation almost immediately, then it becomes a barrier. So some of our findings are revealing that challenge. But consumers should understand that they have a right to these resources. And nurses specifically, I'm sure other clinicians out there are also interested, but nurses will go all the way they can to get these resources for their patients to be able to communicate effectively. And organizations are increasingly trying to establish these resources, but again, there are opportunities in those areas.
Right, but that's a leadership issue. I think leaders of healthcare organizations could take away a lot from this discussion, because those resources do require some investment of time and energy, money, in order to really be prepared to take care of anyone that really walks through your doors and to do a good job. I mean, that point about it's very costly. And dollars and cents for the patients and for the community at large. If patients don't understand, do not really feel that connection, and therefore cannot really get on board, so to speak, with their treatment plan. So I think that in listening to this, I have to just compliment the University of Pennsylvania health system for bringing you in and really having you be a leader in that environment, because obviously that helped them to really get on board and to really get those resources. Now that you're out taking your skills and knowledge to other organizations, what are sort of a couple of the things that people could do immediately? What are some of the early steps for an organization or for individuals to really get these resources?
Okay, when you talk about resources, the first thing is that organizations, like I said, we consider a statewide assessment. But organizations have to do an assessment. It's like taking a pulse of where you are as an organization, understanding that our world is changing, our demographics are changing. So they have to do an assessment to see who are the patients that comes to our organization and what are the values, what are the things that we need to have in place.
Right.
So secondly is education. So educating nurses, because those little nuances sometimes an unconscious incompetence, because no clinician comes to the healthcare environment today, I'm not going to provide care that is respectful of my patient culture. But sometimes this happens subconsciously. So educating your clinicians, healthcare organization, providing the education needed for clinicians to support their patient in respecting their values is key. And I'll give you an example.
Okay.
At one time, I was at Penn, I was consulted for a patient, a 35-year-old woman. Her husband was 40, was dying. And he could not eat or drink anything and was on IV. And the lady requested that he be fed. You know, the nurses, they were really confused that this patient cannot eat anything. And they really wanted to help the patient, be respectful of the wishes of the wife.
Right.
So I was consulted, and I came into the unit, and I spoke with the wife. From talking with her, she understood that her husband will be dying soon. And in order for her husband to cross this world to the next world, he will need some food in his system. And I asked her, would an applesauce help if we put it in his mouth? And he said, yes, anything, even if a drop of fluid in his mouth will give him enough energy to successfully cross to the next world. And I spoke to the nurses. They gave the patient some applesauce. The patient was going to be dying anyway. So, but we met the wife's needs. And 2 days later, the patient died. Why she was crying, but she was so grateful to the nurses, knowing and understanding, based on her cultural beliefs, that her husband will not be hungry when he crosses to the next world. It's something as simple as that.
That is a beautiful story, yes.
But it made a big difference for the patient, and the nurses were very happy that they made this big difference.
Right. Well, I think Rita has really given us a heads up on cultural competence. There's so much more that we could talk about this topic. It's really a rich topic. It is really indicative of a changing world. But what I have gotten out of this show, and I hope you have as well, is that it's really important for clinicians to take this seriously and to have that interest and really do their own searching and knowledge acquisition, really to learn about the people that they're taking care of. And I also have learned that you as a consumer can be a major player in getting that knowledge across, because the more open you are and the more forthcoming, the better it's going to be for you, your family, and for everyone else. So you play a very active role in this whole process of cultural competence. So I want to take this opportunity to thank Rita Adeniran for being with us today. It has been such a pleasure. She is just masterful in terms of really explaining what, again, at first blush may seem like a very simple topic, but nothing is simple. It is very complicated. So I want to thank you very much for being with us, Rita, and I want to invite you back because I think there's really more we could explore with this topic. And I want to thank all of you for being with us today, and hopefully this has been a rich conversation and something that gives you something to think about and to share with others. So we are all products of our own culture. It's not just other people, it's all of us. So we're all in this together. So I want to thank you for listening today, and I want to just remind you, with health, all things are possible. Thank you very much, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.